So, hi everyone, my name is Farnaz Malik and I'm a Senior Technical Advisor at Vital Strategies. So I'm going to just start this session with a story about this photo. It was April 2020 and I was living in my apartment in Brooklyn, New York, not too far away from the local hospital, the Brooklyn Hospital Center. And all the while, the sounds of sirens were frequent. And every day at 7 p.m., the neighborhood would break out into a roar of applause and appreciation for essential workers. And as the virus surged during this time, going on walks in the neighborhood meant potentially running into these large refrigerated trucks, which were actually being served as temporary morgues due to the sheer volume of deaths due to COVID. So while this was happening, health departments and epidemiologists were inundated with data on cases, test positivity, hospitalizations, but also data on deaths. As we learned during the COVID pandemic, it's not enough just to look at illness or morbidity data. We need to also gather data on deaths, which I'll also refer to as mortality data, which gives us a clearer picture of the problem's true toll to then create effective solutions to address it. Here's why. The COVID pandemic, though a particularly devastating time, showed us firsthand how vital mortality data are for shaping public policy in real time. It highlighted the importance of using death data to make informed public health decisions and save lives. So as you probably guessed, I'm here to talk to you about death, but specifically death data, which I'll also refer to as mortality data. So I know mortality data aren't necessarily something we casually discuss with friends or family, given the heavy associations. But in public health, discussing mortality is essential. If we want to improve public health and save people's lives, we also need to talk about why they are dying. Why? Because mortality data tell important stories about the health and status of a population. Mortality data reveal inequities, and they force us to ask questions like, why might maternal mortality be higher among one group compared to another? Where do we see higher rates due to malaria in a country? Why is mortality due to colon cancer suddenly increasing among young adults? And as we experienced during COVID, what does excess mortality reveal about the true toll of a global pandemic, or of international unrest and conflict, or of a natural disaster? And of course, what can be done about these inequities and issues? Mortality data offer profound insights into the health of a population. They reveal patterns and trends essential for informing policies and preventing untimely deaths. And today, I'm going to particularly talk about why it's critical that the health sector routinely uses mortality data from multiple sources to inform public health planning and policymaking. So, COVID, we all remember, the COVID pandemic reaffirmed the importance of a strong public health system that regularly analyzes and uses data. Suddenly the world was talking about this term, excess mortality, which is a measure of the increase in the number of deaths during a period of time compared to what would be normally expected. Confirmed COVID deaths were not alone capturing the full extent of COVID's burden on the population. Excess mortality isn't biased by testing levels and was an important measure to get a better sense of the true toll when reported numbers weren't enough. In fact, in 2021, the WHO released a report where they had estimated that there were nearly 15 million deaths globally due to COVID, and that was 2.7 times more than the 5.4 that were reported due to COVID during the same time period. So it was clear during this time that death data were vital for rapid emergency response. But death data are not just valuable when there's a global pandemic or crisis. Usually the health sector, such as ministries of health or public health departments, they predominantly focus on deaths that happen in health facilities when talking about access to and the use of death data. But we need to remember that in many places of the world, most deaths are actually occurring outside the health sector, such as in the community. In fact, in many countries that are part of the Bloomberg Philanthropies Data for Health initiative, up to 70% of deaths occur outside outside of the health facility, which is just stressing the importance of building a very strong civil registration and vital statistics system, also known as CRBS system, that collects and registers all deaths and causes of death in a country, not just those that occur in the health sector. A strong CRBS system involves connectivity between multiple agencies that are involved, like the Ministry of Health, the National Statistics Office, the Civil Registry Department. And this coordination between government agencies is important for health departments to obtain high-quality population-level mortality data that they can either use directly or for monitoring targets like the SDGs, or to conduct further analyses and then use this information to understand, how to target resources. Together, these agencies can work on identifying problems to then identify and reduce the burden of mortality and ill health. Within the Data for Health initiative, we have seen remarkable success where ministries of health and health departments in countries and cities have undertaken and acted on the analysis of mortality and cause of death data from a strong CRBS system. So I'm going to talk about a few. First, I want to tell you about Peru. So in Peru, the Ministry of Health published a national mortality report in 2018 using data from health facilities and the communities, providing a 30-year trend analysis by age, sex, and location. This analysis then helped in identifying the leading causes of death by location and population groups. So by conducting this analysis, the ministry then used that data to identify inequalities in population groups and geographic groups. And the publication, as you can see, actually received quite a lot of attention and coverage, and it prompted journalists to then interview the government and the ministry and ask them about these findings. And this then invigorated the ministry to kind of refocus their health priorities and look at groups of the population that may have been overlooked in the past. So for example, the ministry decided to launch a pneumococcal vaccine campaign, particularly among elderly people, because as they found in this analysis and in the report, that the elderly population was dying from lower respiratory infections. Another finding was the increased incidence of prostate cancer among men in underserved areas, and the increased incidence of cervical cancer among women in rural areas. And this information was really helpful for the cancer prevention control group within the Ministry of Health to identify, where they need to target their screening efforts. So these critical life-saving interventions would not have been possible without robust cause of death data. In Mumbai, India, we saw the importance of the city health department analyzing death data locally, which is something we actually heard this morning during the plenary about the importance of local data. And they had already been collecting that in their civil registration system. In Mumbai, a strong CRBS system means that nearly all deaths, including deaths in the community, are recorded and have a specific cause of death. So although it's pretty well known that non-communicable diseases are a problem in the population, the analysis of the data actually informed that deaths due to hypertension and diabetes was increasing almost annually in Mumbai. So along with this, plus other data that they had from the WHO STEP survey, the leadership and will of the Brihan Mumbai Municipal Corporation led to the government then in 2022 initiating a policy to expand hypertension and diabetes screening in health facilities, but also in the communities, particularly among the city's informal settlement areas. Since then, over 1 million people aged 30 years and older have been screened for hypertension and diabetes, and then this in turn has identified over 10,000 people with high blood pressure who can now be linked to care. So it was clear that the analysis and use of the mortality and cause of death data in Mumbai from their strong CRBS system was an important intervention to save lives and get people to care. So finally, I just want to tell one more story from Shanghai. So in 2017 in Shanghai, after regularly collecting mortality data, the city found that it actually had a growing burden of road deaths and injuries involving e-bike riders. So a policy option to then require helmet use was proposed to the Shanghai People's Congress by the Shanghai CDC. But as a result of this, a recommendation of helmet use was included in the road traffic management regulations, and that was actually the first time ever that e-bike helmet use was included in any city-level law in Shanghai. And so the city did see see an increase in, like an 8% increase in helmet use, but it still wasn't mandatory. So Shanghai CDC continued to look at their mortality data to monitor trends, but they didn't see that there was a change. So then in February 2021, there was more policy advocacy done to actually include required mandatory helmet use. And the city passed the Shanghai non-motorized vehicle safety regulations. And later that year, the police found that over 90%, there was 90% helmet use among e-bike riders, which was a huge turnaround from the original 11%. This has undoubtedly saved lives on the road in Shanghai today. So regular analysis, both nationally and subnationally in places like Shanghai and Mumbai, of this mortality data is critical to better understand what people are dying from and then what can be done about it. So as these stories show, it's not enough to just have the death data available with strong systems. The data must be used and acted upon to truly save lives. I know that death data are something we usually talk about, but to protect people, we need to know who is dying, where, and why, and we need to make sure that every death is reported. This knowledge is the key to preventing future loss. And I feel like I'm speaking to the choir here. Here at the World Data Forum, we know the importance of data and we know the value of a strong, interconnected data system. And the CRVS system is no different. For countries, improving CRVS systems and ensuring they work seamlessly with government agencies responsible for analyzing and using mortality data is essential. Death data can actually serve as a compass to guide life-saving actions. But to make this impact, governments must not only invest in bolstering their CRVS systems, but also in prioritizing the analysis, dissemination, and use of mortality and cause of death data by the health sector to then shape public health agendas. This isn't just an investment in data. It's an investment in people, in healthier futures, and in the power of knowledge to make every life count. So thank you very much. A special thank you to our partners and our country teams, and thank you to all of you.